Hi friends, welcome back to USMLE team. Today's topic is classes of hypolipiemic drugs. I will just discuss the important points related to USMLE step 1 examination. So sit with me and you will go out with some knowledge and some experience or some information that will help you for your coming USMLE step 1 examination. Okay guys, before starting this I would request you to subscribe to our channel. Our channel name is All or None Law, and please tell your friends to subscribe because we require your subscriptions. Okay, please subscribe. Statins, we have statins, fibrates, niacin, then the other drugs, right? So I will discuss briefly about this. Regarding the individual and the important drugs, I have discussed in a different video. If there's any important video or any important drug to be uploaded, definitely I will upload on that. Okay, just my aim is you should concentrate on USMLE step 1. That's it. Okay, statins are particularly well suited for lowering LDL, the cholesterol with the strongest links to vascular diseases. In studies using standard doses, statins have been found to lower LDL. So they can ask you which of the following drug is more effective in reducing LDL. Statins, fibrates, niacin, blah blah blah. Okay, depending on the specific. Okay, there is a risk of severe muscle damage, myopathy, and rhabdomyolysis with the statins. Remember, in USMLE examination, they give the history and the patient is taking statins, and they come up with a next day with or after a few weeks that they have the pain in the muscle or the hematuria, blah blah blah, or hyperkalemia. So think of these things. Okay, it could be due to the statins. Okay. Fibrates are indicated for hypertriglyceridemia. I recently uploaded a video on fibrates. Okay, there is a gemfibrozil. There you can see I have discussed the indications. Okay, if LDL is increased, cholesterol is normal, which drug should be used? If cholesterol is increased, triglycerides are normal, which drug should be used? If triglycerides are increased, cholesterol is increased, which drug is the first line? That's how I discussed. Okay, just go and watch my video on a gemfibrozil or gemfibrozil, whatever you call. Okay, fibrates typically lower triglycerides by 20 to 50%. Low level of the good cholesterol HDL is also increased. Fibrates may decrease LDL, though generally to a lesser degree than the statins. Remember, this is a point you should know. Though they decrease, the fibrates also decrease the LDL, but the amount of LDL decreased by the statins is really more than the fibrates. There is a risk of severe muscle damage also, but compared to the fibrates, statins causes more severe myopathy. Okay, niacin, like fibrates, is also well suited for lowering triglycerides. It may also lower LDL by 55 to 25% and increase HDL. Niacin may cause hyperglycemia and may also cause liver damage. Look at this. Niacin may cause hyperglycemia, so it should be cautiously used in the patients of diabetes mellitus. Okay. The niacin derivatives Hypolipiemic is also associated with a modest decrease in the LDL. Bile acid sequestrants or resins are particularly effective for lowering LDL-C by sequestering the cholesterol containing bile acids released in the intestine, preventing their reabsorption from the intestine. It decreases the LDL by 15 to 30% and raises HDL by 3 to 5%. It has a little effect on a triglyceride but can cause a slight increase. Bile acid sequestrants may cause gastrointestinal problems and may also reduce the absorption of other drugs and the vitamins from the gut. So these are the very important points about these drugs. Okay, azentimab is a selective inhibitor of a dietary cholesterol absorption. Okay, lomitabimab is a microsomal triglyceride transfer protein inhibitor. Orlistat, it is a primary function is to prevent absorption of about 30% of the fat from the human diet, thereby reducing caloric intake. Is by inhibiting pancreatic lipase, an enzyme that breaks down the triglyceride in the intestine. Okay, these are the important points about the classification of